Welcome to Adapt NCLEX. If you mix high-risk pregnancy questions on the NCLEX, they will know it. Therefore, in this video, we're going to deal with 10 high-yield, high-risk pregnancy questions dealing with preeclampsia, bleeding, ectopic pregnancy, exactly the stuff you will see on the NCLEX. Let me make it easy for you. Pause the video, answer it, and then I'll give you the explanation. Detail 1. Let's get to it and master this content. First question, look at it. Don't freak out. You know it. Like I said, you stop the video, attempt to answer it, then play the video, and then look at the way I'm going to approach it. It's a straightforward question, similar things you will see on the NCLEX. This is the way you should approach it. Which action is a priority? That means all the other options are right. But what? The word priority should be your key. Read the question from the back. Why should I be a priority I should be worrying about? Okay, 30-week client has contraction every 6 minutes and the cervix is 2 centimeters. Then you ask yourself, they said, which action is a priority? Administer beta medicine. 2, start IV hydration. 3, obtain urine culture. 4, administer methamphetamine. Which one would you give to this patient? Then you bring your content, like I teach you every day how to answer the question. Is there a priority? Go for the buzzwords. 30 weeks should trigger something in your head saying, hey, 30 weeks, she's not full to term yet. And she's contracting every 6 minutes and the cervix is 2 centimeters. You see that short question, no ambiguity, straightforward like the NCLEX will ask you. All I'm telling you, this is what? Preterm labor. Something should tell you the patient is in preterm labor. 30 weeks contracting in a regular fashion with cervical dilation. Hey, this is preterm labor. Therefore, ask yourself, what do? You prioritize in preterm labor. 2 things. Based on the weeks. If it's less than 36 weeks, I've taught you this before. I want you to remember it. The first thing you should do is to stop contraction. Which of this will stop contraction? What do you think? Which one will stop contraction? This is what we're dealing with. Which one will stop the contraction? We are in preterm labor. The right answer is starting IV. And why? Let me break it down. I need to give you the answer first, then let me break it down. If you give the beta medicine, it's on the wrong thing. She's 30 weeks, not close to 36 weeks. And therefore, our priority is to stop contraction. So even though it may be needed, not a priority in this question. IV fluid will stop contraction. It's the easiest things you can do based on the answer choice we're giving. If you obtain culture, you're thinking about infection causing the contraction. It's going to take a while. Methamphetamine causes contraction. We are in trouble. You want to deliver the baby? Negative. So number 2 is the right answer. All of the questions, that's the way I want you to think about it. I set them to make you think critically to master maternity. And this is the home of maternity questions. Come back and learn more. This is number 1. Let's get to number 2. Which action should the nurse prioritize? A client at 7 weeks gestation collapses with severe abdominal pain and hypotension. Same thing. What do you prioritize? Apply oxygen, give them IV opiate, prepare for emergency surgery, and assess for fetal heart tone. Same thing. Just go for the buzzword. You have to go for the buzzword. Then you can figure out, bring your content. And as I've taught you multiple times, you're going to use the same approach. Which action should the nurse prioritize? That means all of these answer choices are right. I'm picking the one that is the most prioritized one. That will help the patient. The client is 7 weeks. That should tell you something. Every time you take an OB, they give you weeks. There's a reason why. 7 weeks, she's not even near term. Something is wrong. 7 weeks. And what did I do? Collapse. How do you collapse? Something happened to you. You have severe abdominal pain and have hypotension. That means she's bleeding and she collapses. 7 weeks. What is the number 1 cause of bleeding in the 7 weeks? First trimester. That will cause you to have abdominal pain. Think about it. It's not miscarriage. What do you think? This is what we call what? Ectopic pregnancy. She has classic signs and symptoms of ectopic pregnancy. Based on that, what will you prioritize? What would you prioritize based on that? Stop the video, pick your answer, put it down in the comment, and let's take a score. If this is ectopic pregnancy, she's bleeding. What will you prioritize? Oh, oxygen, opiate, fetal heart tone. Fetal heart tone is, the baby is 7 weeks. We don't even care about the fetal heart tone right now. We want to save the mommy. So that's the wrong answer. The right answer is prepare for emergency. Why not oxygen? Of course, oxygen is easy. I can slap it on the patient. But the word prioritization means this is what you want to provide better judgment, better help to the patient. Oxygen is not going to solve this hypotension, this abdominal pain. It's just going to provide oxygen. But the one we should prioritize is to fix the bleeding and hypotension. Requires surgery. Opiate is going to worsen the hypotension. You see how you can answer all the questions. And fetal heart tone is unnecessary. Don't pick number 4. 7 weeks, we don't care about the baby right now. Mommy is the one who is dying. Number 3, a 35 weeks pregnant client with severe preeclampsia reports new epigastric pain and nausea, and blood pressure is 168/104. What is the next? What is the priority action? Once again, the video is about what? High-risk pregnancy. Therefore, you have to think about it. In nursing, it means OB emergencies. These are classic OB emergencies. The NCLEX is a safety question. This is what you're going to see, whether in nursing school or in the NCLEX. They give you a safety question that you can think critically and solve the problem. What is the next? What is the priority action? Give the patient acetaminophen, place the client in high follow position, notify the healthcare provider, encourage oral fluid. Then go back and say priority action. You underline it. Okay, I got to be sharp, right? 35 weeks, not there yet, but she has what? Severe preeclampsia. We are in trouble. We want to prevent seizures, right? And she report epigastric pain. That's your buzzword. And the blood pressure is high. The blood pressure is consistent with severe preeclampsia. The presence of epigastric pain has changed everything. When you have eclampsia or preeclampsia and you start having GI symptoms, epigastric pain, we are developing what we call HELLP syndrome. And therefore, this is a worsening condition. And HELLP syndrome is dangerous, more than preeclampsia or eclampsia. And therefore, what are we going to do? HELLP syndrome. You're going to give them acetaminophen for that. You're going to place the client in high follow position. You're going to notify the healthcare provider or encourage fluid. The right answer is we got to let the doctor know. We got to deliver the baby as soon as possible because mommy is in trouble. She's about to have seizures. Either she's going to have seizures or they're going to be complication to the patient. Every time they give you a case, they tell you the patient has preeclampsia or severe preeclampsia, and they develop epigastric pain. Watch for seizures or HELLP syndrome. We should do that. Acetaminophen is going to affect the liver. We don't even going to give it to the patient. High follow position? No. If you worry about seizures, left lateral position. Patient should be MPO. Number 3 is your right answer. What action should the nurse prioritize? Question 4. What is your score right now? I want you to put it down in the comments. Let me know. How are you doing? This is maternity dealing with high-risk pregnancy using English practice questions with rationale in detail so that you can recognize all the key facts, the concept that you need for maternity. Which action should the nurse prioritize? Read the question from the back. There's taking strategy from the back. That means all the 4 options there are okay, but only one is the most important. Client receiving magnesium sulfate. Why? For probably has eclampsia or preeclampsia. And therefore what? Has absent tender reflex. So side effect of magnesium. And the urine output is 20 every hour. That is oliguria. It's low. What would you do? I've given you the buzzword. I've read it the way I want you to read it when you're taking the test so that you can understand it. I'm going to continue infusion and reassess the client in an hour. Is this what you would do in rare situation, in nursing school, in clinicals? Will you do that? No reflex, low urine output. I'm going to increase IV fluid, number 2. Is the appropriate action? I'm going to stop this magnesium infusion, stopping the poison. Document finding as expected. Is this normal? You know that this patient is in trouble based on what I've told you. Bad problem. And therefore, we need to stop the infusion and prepare to give what? Calcium gluconate as antidote. You can't continue the infusion because these are signs and symptoms of magnesium toxicity. What are the other signs and symptoms? Magnesium lower everything. Your reflexes go down. Your heart rate is going to go down. Respiratory rate go down. Urine output go down. Your neurological, your GCS go down. So if you see anything less than 20 and no reflex, we got to do something. IV fluid is not going to solve magnesium toxicity. Documenting the finding as normal is like, no, that's unacceptable. Therefore, 3 is the right answer. Halfway, midway. What action should the nurse take? The 37-week client has sudden abdominal pain, buzzword, firm uterus, buzzword, dark vaginal bleeding, buzzword, and a fetal heart rate of 90. What should you do? Insert the Foley catheter, position the client on the left side, start pitocin, prepare for emergency C-section. What do you think? How would you approach the question? Which answer choice you think is appropriate? Go through the motion I told you. Never stop doing that. Stop the video, underline the key facts in the answer choice in the question, and then look at the stem of the question. Go and pick your buzzword. And this is the way I want you to break down. Action to take. I have 37 weeks. Severe abdominal pain, bad problem. Firm uterus, bad problem. Dark bleeding, bad problem. Baby is in trouble. That is fetal distress. Therefore, what high-risk pregnancy complication do you think is happening? And based on that, what would you do? The presence of dark vaginal bleeding and abdominal pain, it means an abruption with the baby having what? Distress. If this is a placenta abruption and the baby is having problem, what would you do? What is your answer? If you can put it down, hashtag number 5, I pick it 1, 2, 3, 4. I will appreciate that. But I can tell you, we got to prepare for C-section. Foley, of course, when we get to the operating room, we will put it there. Position the client on left lateral. You're thinking this is what? Placenta insufficiency? Of course, there's still going to be placenta insufficiency, but this is abruption. It's not going to solve this blood pressure. Pitocin, the mommy is having abruption, no contraction. Therefore, 4 is the right answer. Number 6, which action should the nurse take? Same thing. The client with non-placenta previa, you have to understand what is previa, begins to what? Have active vaginal bleeding. I'll break down the scenario for you. Perform what? Leopard maneuver. Is that important for placenta previa? Even if you don't know, go over the buzzword. Placenta previa. I'm bleeding. What do you want to do? Do you want to touch the uterus? I don't know. You think about it. Start large bore IV access. Is that appropriate? Perform a vaginal exam. Is this what you've learned so far? Don't get trapped. When you see a question, just because it's there doesn't mean it's right. Let's take in strategy, stick with your gun. Ambulate to the bathroom to avoid what? To void. What do you think? Placenta previa is when the placenta is covering the cervical horse. And therefore, when the baby contracts, pushing the placenta, and there is bleeding, bright red, vaginal bleeding. Which action should you take? Mommy is now actively bleeding. This is where you have to apply your clinical skills and nurse. If you're taking care of this patient in clinical life, in nursing school, the patient is bleeding, bleeding. You have this patient bleeding. Will you go and manipulate the uterus to check for fetal position? That's leopard. Will you insert IV fluid and give them fluid? Think about it. Will you look into the vagina? Something tell you you should not do that. Placenta previa, no vaginal exams. Therefore, the right answer is number 2. Why? We need to resuscitate the mommy. We can go to surgery, but not right now. We have to resuscitate the mommy. Make sure we get them more fluid and stabilize them as much as possible. Manipulating the uterus, that is number 1, is wrong. Vaginal exams are going to cause more bleeding. Baby, mommy walking is going to cause more bleeding. Therefore, IV fluid is the best thing. And the key concept I put usually on the yellow, if you look at it, is active bleeding, require IV access, blood product, and lab. Number 7, which finding indicate effective glucose control in this client? The nurse is caring for a client with gestational diabetes. Which one indicate effective control? This one will give you the content. Even if you don't know, look at the numbers. If you have diabetes, right, and I'm asking for control, well, I'm not going to pick a glucose that is high, but I give you 2. Report increased test is not important. 2-hour post-meal glucose of 200 is too high, right? That is what? You want something less than 140. The fasting one should still go lower than 140. 130 is still too high. The best answer is 85. But the good answer, what you need to know is 90. And 90 is always the best answer to aim for when you're looking for fasting glucose. So anything less than 95 is good. So number 3 is the right answer. Write it down. Number 9, which finding is most concerning? The nurse is assessing a client with purely controlled gestational diabetes. I'm building up on question 8. Poorly controlled gestational diabetes. Which finding should worry you? Fundal height larger than the date. Complaint of mild heartburn, increased fetal movement, occasional bursting His contraction. Right, it's straightforward question. The content is what? I gave it to you. Poor glucose control. What is going to happen? The effect of glucose control on pregnancy is what? Baby is going to get bigger. Macrosomia. If baby is getting bigger, what do you think is the right answer then? What do you think? I can tell you, we have macrosomia, and the right answer is number 2 because number 1 because the baby is bigger. Baby is bigger, the fundal height will be larger than the date. So you'll be 20 weeks, but the fundal height is near the xiphoid, almost like 36 weeks. Complaint of mild heartburn doesn't change anything. It's not concerning. It's a problem, but it doesn't concern you. We got to fix his basic care and comfort. Okay, we give you something to help with your nausea. Increased fetal movement is a good thing. I'm not going to worry about it. Contraction, bursting Hicks is also a good thing. Therefore, not going to worry about. 10 questions. Almost done. One last one. This is what to test you to put everything together. We saw HELLP syndrome. There's one key thing. I intentionally did not give it to you. I want you to talk about it here. If you know it, this answer pop out like a candy, like I always say. The nurse is caring for a client with what? Preeclampsia, which findings support HELLP syndrome. Like I say, you progress from preeclampsia and eclampsia to HELLP. Some people will move from preeclampsia to HELLP syndrome right away. What is the definition of HELLP syndrome? Which answer choice will you pick? Let me know. Stop the video, answer the question, try it, and then play the video. This is how you benefit from my videos. This is the way I want you to approach it. And this is the way I want you to do that. This is HELLP syndrome. The right answer is what? Number 2. Why? Because HELLP syndrome, break it down. This is HELP. Hemolysis, right? The HE is hemolysis. The other E is elevated liver function, right? Elevated liver function. And another LP is low platelet. So these are the things that constitute low platelet, elevated liver function, and hemolysis, you bleeding. So they're going to have anemia, they're going to have petechia, they have features of low platelets, and their liver function is going to be elevated. It's like DIC. Therefore, based on that, Y count of 1200 is normal in pregnancy due to changes that occur. HDL has nothing to do with what? HELLP syndrome. Even high HDL is good. Platelets here is normal. Therefore, this is elevated. This is adapting class. Thank you for watching. And if this video helped you with your NCLEX prep or nursing school prep, put down a comment, click on the like button, subscribe for more content about OB, maternity, high-risk pregnancy. Thank you and have a good day.